Not into long podcasts? Don't worry, we've got bite sized clips just for you. This is CWN Clips. Please don't forget to subscribe. You did India's first high cervical spinal cord stimulation case you
Yeah.
performed for Parkinson Plus on a 65-year-old patient from France. I'm curious to understand, what was the complexity and how do you think that's a breakthrough for more patients to come
Yeah,
in, right?
exactly. So, like I told you in the beginning itself, Naga, that we have this group of patients who mimic Parkinson's, called Parkinson's Plus, right? So, she was one of those candidates. She had what is called as Parkinson's Plus. So, she used to have repeated falls. She could not have control over her urine. She had to get up in the
Hmm.
night multiple times to go. So, these are all red flags for us, even when we are looking at patients with regular Parkinson's. So, when we see these red flags, we know this is Parkinson's Plus. So this lady had all these features. She had what is called as anatomic disturbance. That means if you measure her BP standing up, it used to be a little okay. And if you measure her BP lying down, there used to be a significant difference. So
Oh.
these are all changes which we see in patients with Parkinson's plus. So this lady could not even walk with support. She needed at least 2 to 3 people support to walk. So usually we don't offer deep brain stimulation for such patients. So what we tried was what is called as high cervical spinal cord stimulation. That means I put an electrode near the neck. So that is the
Hmm.
cervical spinal cord. So what happens in that is there is this flow of electricity that is coming from the brain and that gets very concentrated near the upper part of the spinal cord and then goes down into the spinal cord to the rest of the body. So that is the area cervical spine, which has a lot of concentrated activity of electrical activity, which is going up and down the brain. So when we did this stimulation, what happened is all her hand movements became much more freer. Our gait became significantly better. Our urinary disturbance became significantly better. It's not like she became normal, but compared to what she was in a wheelchair, unable to move around. Now she's able to move around with one guy's support. Her urinary symptoms completely improved. So that was the kind of breakthrough. Is it something that is experimental? Definitely not. So there has been, like you were suggesting previously, there have been what is called as studies, anecdotal studies, where it is clearly established that when you stimulate the cervical spinal cord, the gait disturbance can get much better because we know that's how the movement is controlled. There is a lot of physiological and scientific background to doing that cervical spinal cord stimulation. So this lady had actually tried in all the pioneering centers in multiple places around the world. And when
Wow.
we came, we sat with the husband, and then had a very long discussion and had a realistic idea of what is he going to get from this stimulation, because it's very important, right? If patient has to undergo a surgery, they have to get convinced that it is going to get them better.
Right, right,
Okay.
true, very
So
true. Yeah.
we had a very realistic, honest chat with the family, and then we did the procedure. And to our luck or to her benefit, she had a tremendous response and she did really well. So we have done that even subsequently to other patients. And the advantage of the spinal cord stimulation is we can do what is called as a trial. That means we put the electrode and check how the
Hmm.
response is. If the response is very good, then I put the permanent pacemaker. So that's what
Hmm.
we did with her, and she did really well. And we have presented it even in scientific meetings, and she's doing well.
So we have to, again, it's more of a minimally invasive in
Yeah,
these cervical to fix
very
that
minimally
electrode.
invasive.
Hmm.
Yeah, we make a small opening in the back of the neck and place the electrode. The electrode is about say 10 millimeter in width and
Hmm.
about 14 or 16 millimeter in length. So that's the kind of electrode, and we make a small opening and then push it through that.
It's wonderful. I think it's a life-changing moment for somebody who's
Yes.
been going through something of that sort. And I think especially anything with spine and neuro, it impacts your whole body
Yeah.
movement and your ability to talk or anything which is more of a stroke or of that sort. It's a highly impactful time, and
Yeah.
I think these technologies actually reviving a lot of lives through that. I mean, kudos to you
Absolutely.
and the
Like I
team.
told you. Yeah. Like I told you, even DBS for that matter is a really life changing surgery. So we have done surgeries for patients who were surgeons who could not operate because their hands were shaking. They had to cut their practice off, saying that I won't be able to do it anymore. And we did the deep brain stimulation for them, and they're back to their full fledged practice, including doing laparoscopic surgeries, which is much more advanced. So that's the kind of really life changing things. We have young guys who thought, okay, my career is over, I can't work anymore. Now traveling all over the world, doing everything that they wanted to do, including doing gymming, playing active sports, they were able to play. So that is the kind of changing things that DBS does.
Yeah, I think I saw videos of after DBS, somebody's finished the complete triathlon and
Exactly.
won it too. Yeah. Um, but so DBS again, it is more of a minimal. It's again a minimally invasive,
Yes,
very
yes,
focused, uh, surgery where you put the electrode in the brain, in a
correct.
specific part. Let's say if it's a dopamine or that substantial niagara, so where you place it and then
Yeah,
charge with.
yeah. The area is called the subthalamic nucleus or the globus pallidus centers. So that is very close to the substantia nigra. So these targets have been refined and found out over a period of time with multiple studies. So that is the area. Why is it called deep brain stimulation? The deep in the meaning DBS is because it's very deep seated. Yeah, and it is so specific. The STN nucleus is only about 5 by 6 into 12 millimeters, so it is as small as that. So you need to be extremely precise, and even in that subthalamic nucleus, I have to target an area which controls movement. So that's why the surgery is so advanced, and that's why it's so much dependent on an interaction between technology and the surgeon himself, so that you get an highly accurate results and good benefit to the patient.
And also, I understood that during the surgery, the important things to hear is the patient's voice, because the patient is active and talking during the
Exactly,
surgery, and
exactly,
because it is not the area in the brain where your cognitive is impacted, so it is the movement. So you are continuously talking to the patient
exactly.
throughout the surgery, right, and making sure that he's
Exactly. So it's a awake surgery. So imagine somebody drilling a hole into your head and putting electrodes into the brain, and it's so beautifully done that even if I touch your brain with the hand, or even if I cut your brain, you will have no pain. So God has designed it in a way that the center, which receives all the information, all the pain information from rest of the body, has no pain by itself. So that's like really amazing. So these are the few things that always excite me so much. So my patient is completely awake. We give him only local anesthesia in the head so that they don't have any pain over the skin, and there is a layer called the dura of the brain, which is the covering of the brain. These two structures are the only pain sensitive structures. So we anesthetize them, and then we do this whole procedure with the patient being awake, and he's also contributing. That means he tells me that my hand has become free, my hand has stopped shaking. So that way we get a confirmation that we are in the right place.
True, I think, and then during the surgery, you will hear all the brain neurons
Correct.
interactions throughout the
Correct.
surgery, right? I think there are some
Yes.
live videos in the YouTube too about the
Yes.
whole DBS, and it's amazing
Correct.
to look at
Yeah.
the kind
We,
of
we record from, yeah, we record, like you said, the activity of the neurons. It's called microelectrode recording. So the electrodes are so fine that we can actually record from a single neuron.
yeah, true. Okay, it's like goosebump moments. I think when you're doing it, I know it's how uh, mentally stable you have to be. So kudos to all the surgeons, right? I think.
Thank you.
This is just a glimpse of one of the many conversations we've had in this channel. If you found this thought provoking, please don't forget to subscribe and explore more insights from unfiltered voices and the real world experts. And please don't forget to like and share this video to as many people as possible. It keeps us going. See you in the next one.